We've heard of vampire facelift, but
We have.
vampire breast lift, what is it?
So a vampire breast lift basically utilizes the same concept of a vampire facelift, in which we're injecting the patient's blood into the breasts. Now, if you look at where we're doing it, we're actually injecting the cleavage plane into the breasts, because a lot of, and I know this because many of my patients will say they want more cleavage to basically look more flattering in some of the modern fashion that they're using now. So basically, a vampire breast lift injects platelet-rich plasma into the cleavage to augment the cleavage.
And what happens? It starts to build out?
So over time it grows, it recruits more fat cells, and the cleavage plane in the inner part, and we have some pictures we could show, is more rounded. It can work with patients with implants, without implants. In our practice, we see a lot of OB/GYN patients who after childbirth, the second, third, fourth, they have inverted nipples, loss of nipple sensation. A vampire breast could help with that. And they just want to have some fullness to the breast, particularly in the inner part where fashion tends to show off to their breast skin. So we call it vampire breast lift. In some cases, we could actually do more and remove fat from, say, the love handles, or do liposuction and pull out fat and increase the overall breast size.
Then you just what? Inject the fat right there?
Right into the breast.
And
it takes, yeah. Especially when you inject platelet-rich plasma.
So you do a combination of that and the platelet. You could take somebody with a very wide gap, like a thinner person, and give them cleavage.
Absolutely, exactly. And that's oftentimes what the patients are asking for. Now, in our practice, we call it the female trifecta. I've done a few of these.
Female trifecta.
Female trifecta. So what's a female trifecta? Female trifecta is a patient who comes in, we do an O-shot on them, we do a vampire facelift, and then we do a vampire breast lift. So if you think about it, this identifies and actually treats many of the symptoms all in one procedure. So they have issues with orgasm or intimacy, we do the O-shot. They have issues with nipple sensation, they want more cleavage plane, we do a vampire breast lift. They're looking tired, they don't feel sexy, they don't feel attracted, we do a vampire breast lift, facelift. So this is what we call the female trifecta.